Hello, my name is Dr. Dom Colino of Back to Wellness Chiropractic. I've been in practice in Sheboygan for over 20 years. I specialize in utilizing the latest advancements in chiropractic techniques, including the Pro Adjuster, and as you'll see in a little bit, the Insight. As you learned in our first video presentation, chiropractic seeks to normalize joint function or spine function to then affect the nervous system. Today we want to show you what's unique about our practice, and in doing so I've provided this graphic that I explain to my new patients and explain to them how each of the nerves has its own unique function. There are in fact motor nerves that control muscles, and when there's a subluxation it can cause weakness, spasm, fatigue, or tightness. There's something called the autonomic nervous system, which controls organs, glands, and blood vessels, which was described very detailed by Dr. Windsor in that 1921 article that I had a link to on our last video. And then of course there's sensory nerves, which typically involve pain, posture, hot and cold. And when there's a subluxation, any of these or all of these can be affected. One of the methodologies in our practice that we use to identify where these areas are in your spine is something called the Insight, which creates a very detailed analysis of your spine when you come to my office so that we can sit down and make a determination as to, is chiropractic right for you, and if so, what I can and can't do, and how long it'll take in order for us to achieve your stated goals. So this is the Insight Subluxation Station. This tool is one of very few in northern Michigan. It allows me to have just that, insight into your nervous system. This is actually my scan today. And what normal should be is little white lines here, as I have. Green is a little bit of a problem, red is a significant problem. And I could tell you from my own personal experience, I've been having some headaches lately, so it's time for me to actually go and get my own adjustment. But what this tool does, it allows me to determine what side and how severe my problem is, or yours. The Insight Subluxation Station was originally funded and researched by NASA. Reason being, NASA wanted to be sure that the astronauts had the best optimal nervous system functioning while they were going through their training and also in space. Later on, this technology was brought to chiropractors, and we now utilize it to analyze our patients to provide the best possible care.
Begin scan. S1. Left C1. Right C1.
So what these two sensors do is they pick up electrical impulses from the skin. There's no pain. You don't feel anything when you have this done. And here we go.
Begin scan. C1. C3.
In 2005, I was introduced to the Pro Adjuster, and at the time I thought, what an interesting and innovative technology to analyze and treat the spine. Back when I was in school, I was taught that through palpation or utilizing my hands for analysis, there was a 30% accuracy, and at the time, being a student, I didn't think that was all that good, and it disturbed me and always caused concern, because how can I be sure that the treatments I'm rendering are the best possible for my patients if I'm only accurate 30% of the time? What sold me on the Pro Adjuster was not its gentleness, but it's a 98% inter-examiner reliability, which means in English, it's only wrong 2% of the time, which in medicine is unheard of. What this tool does is it utilizes a very sensitive analyzer called a piezoelectric sensor, and it taps on the spine and it moves each vertebra minutely. And it creates a graph for me to analyze to then make a determination as to what to adjust. If the vertebra is significantly fixated or stuck or out of place, it creates a very significant arch. And if the joint has edema or swelling, that is also indicated, or any permutation thereof that's not normal. When this tool measures motion, this graph allows me and the patient to determine how are they doing day to day, visit to visit. Where the insight allows me to get a more of a long-term view of what's been going on with their nervous system. When I find an abnormality on this, I simply highlight the screen, go to the adjust screen, and it automatically sets the parameters to correct for that problem. The tool taps very gently, and in doing so, it's oscillating or moving this joint minutely. There's no twisting, no turning, none of the standard fare associated with chiropractic adjustments. It automatically turns itself off at each vertebra. So again, the patient can make a determination, wow, I'm in really good shape, or boy, I'm really glad I came in because it took a significant number of taps in order to restore that joint to proper function. On top of the Pro Adjuster, I also utilize standard chiropractic adjustments as well, if I feel it's necessary. And those techniques and methods are pretty much the same amongst all chiropractors in our community. There are a couple of neat features that this table allows, something called flexion distraction, which if a patient has a disc herniation in the lumbar spine, this table does in fact bend down and separate to help relieve that pinched nerve.